So we are going to move right along with our next speaker, and that is Laura Brown. She's a pediatric speech pathologist who specializes in early intervention, and she owns a private practice in Marietta, Georgia, where she lives with her husband and her 2-year-old son, and she's got another one on the way in May. Laura is the founder of Mommy and Me Milestones, which is a website created for parents and therapists to support the development of early communication skills. She's also the author of the Practical Baby Sign Handbook, a resource for introducing signs to improve the communication skills of young children. I know I love recommending sign language as a tool for caregivers that I work with, so I'm really excited to hear what Laura has to teach us today about using signs to support preverbal children. Laura, you're up.
All right, thank you so much for having me. Let me get this shared. And okay, you can see my screen, right? Okay, great. All right, so I'm going to be talking about using sign language in early intervention therapy and using signs to support the communication skills of young children with limited spoken language. We kind of covered a little bit about me. I am extremely pregnant and due in 6 weeks, so forgive me if I am out of breath at any point in this little talk. I'm going to jump right in to starting therapy with children who are preverbal and minimally verbal. When we start therapy with this population, we want to target preverbal skills and consider options for AAC. We want to explore any options we have immediately for giving them a better way to communicate while we work on getting them more spoken words. So as you know, AAC, or alternative and augmentative communication, refers to methods of communication that allow people who have limited verbal output to communicate. Sign is considered an unaided AAC option that can be combined with the spoken modality for young children. Signing should be considered along with other methods of aided AAC, like picture exchange systems, communication boards, and speech generating devices when you're choosing the modality of communication that is going to be the best fit for your individual patient. All right, so let's talk about the difference between some of these terms. So we have sign language, baby sign, manual sign, ASL. There's a lot of different terminology. So just to be clear, when we introduce a limited amount of signs to support the communication skills of hearing children, we're using the sign vocabulary as an enhanced system of gestures, gestures that they can use to communicate for a wider variety of purposes. So the colloquial term for this is baby sign, but it is also referred to as manual sign or just sign language. Like most American SLPs, I teach ASL signs. And it's important to know that we're borrowing this vocabulary from ASL. We're not actually teaching ASL because ASL has its own syntax and morphology and pragmatic standards. It is its own unique language. If you have heard of Makaton, that is a system of signs and gestures popular in the UK, and they borrow most of their symbols from British Sign Language. And sign language is not universal. Most countries have their own unique formal sign language system or sign language. All right, so who is a good candidate for introducing signs? Late talkers and young children with a variety of developmental disabilities can benefit from these supports. That might include kids with severe speech sound disorders, children with autism, or children with Down syndrome. I've had a ton of success with my standard late talkers with signing with them. Those are your kids who have the average receptive language skills, but they are lagging behind in their expressive language skills, and they tend to pick up signs really quickly. Children who might not be good candidates for signing, any child with severe motor impairments, children who are over the age of 4 who are continue to be nonverbal and minimally verbal, and then also children on the autism spectrum that have that level 3 diagnosis that indicates the most significant impairments in social connectedness and communicative intent. And those kids tend to struggle with acquiring signs. Well, some of them do for that reason. Just a note, if you're working with a child who's deaf or hard of hearing, you need to consider the communication approach that the family has chosen for that child, and consider that approach when you determine how to appropriately incorporate signing for those children. All right, so when we introduce signs, we are expanding on the natural development of gestures. As you know, gestures emerge naturally prior to spoken language, typically between 9 and 12 months, and they remain the primary method of communication for most children under the age of 18 months. And signing can give children access to an expanded set of symbolic gestures to increase their functional communication skills. And we know how important gestures are in language development. Gestures are proven to help young children learn language and to improve their word learning. And early gesture use is also positively correlated with receptive and expressive language skills later in childhood. All right, so let's talk about the benefits of signing. Signing can give a child access to a system of communication. This visual here kind of highlights the different pragmatic functions that you could use a sign in order to get your needs met. So getting basic needs met, requesting, commenting. You can see those 9 examples there. The idea is to improve functional communication so that a child can communicate for a variety of purposes. One of the other benefits is decreased frustration. We know there's a correlation between decreased expressive language skills and increased temper tantrums. So kids who struggle with communication skills tend to have more significant behavior problems as reported by their parents. And late talkers are twice as likely to experience severe temper tantrums. So there's been evidence that introducing AAC can reduce challenging behaviors, especially in young children. Another benefit, using signs can promote word learning and can facilitate spoken language. So there's been lots of studies around speech input with iconic gestures, promoting language development and word learning. And children who received sign input had higher language skills at 2 years old compared to children who received verbal input only. And children who demonstrated below average language scores showed improvements in expressive language when they were exposed to enhanced gestural input. This is one of my favorite benefits of using signs with families. Research shows that introducing signing and supplemental gestures can improve the reciprocal communication between a parent and a child. And we know as therapists in general how important that reciprocal communication and that responsive parenting is to early communication skills. Parents who use signs were more tuned into their child's nonverbal attempts to communicate, and they were more likely to engage in those early conversations by following their child's nonverbal cues. And additionally, parents who use sign with their children had more positive thoughts about their relationship with their child and less stress. So I think those are really neat benefits because signing can benefit the parents as well as the child. So especially if you're in an early intervention model where you're coaching and involved with families, and that's a big piece of it, that's a really important thing to consider. Okay, so I know we've all heard this parent objection to signing, and that is that signing will prevent my child from learning to talk. So we just talked about all of the awesome benefits of introducing signs. So take time to educate parents about those benefits. And know, and a lot of you do know that there's a well-established consensus in the research that AAC and signing does not inhibit spoken language development, and it can actually promote the development of spoken language. Okay, I'm gonna keep moving to stay on time. So success with signing. Let's talk about what we know from research about AAC and language development to help you be successful with this strategy in therapy. So we know that we want to emphasize functional communication. So we focus on functional first and foremost, helping the child to communicate for a variety of purposes. Another way to look at functional communication is using signs to replace less desirable behaviors. So here are some examples. So these are things that like every single toddler does, usually on the left column. I know mine does, or did at some point. So throwing food when they're done eating, you could replace that with the sign for all done. Grabbing something out of a sibling's hand, replaced with the sign for please, want, or give. Pulling on their mom's shirt to be picked up, replaced with the sign for up. Trying to open the front door, replaced with the sign for outside. Becoming frustrated and screaming and crying, you could replace that with the sign for help. So if you think about how you could use this to kind of curb some of those less desirable behaviors, this is another thing you could kind of present to any parent who's having trouble understanding the value. You could say, look at all of these things we can replace if we had a way for your child to communicate. So success with signing, we want to incorporate core words. These are the words that make up over 80% of our total words used. And teaching core words leads to more frequent communication attempts. They are powerful because they can be used across many contexts. And our vocabulary targets should include both core words and those high value, what's called fringe vocabulary words, those, that more noun vocabulary that is important and meaningful for the child. Additionally, we know that parent buy-in is really important. So we have this, I know a lot of you have seen something similar to this pie chart on the right, where we have this little sliver of dark green, which is the amount of time that we usually get to spend with a child, and the whole rest of the circle, which is all of the time that the parent is with the child. So getting the parents involved and on board, spending lots of time coaching and educating parents about how to use signing is going to be really important for the child to be successful with this strategy. Other key things to keep in mind go along with just some basic strategies we know for language development. So we know the importance of modeling. You'll have to model signs a lot before we can expect the child to start imitating them. And then some additional ideas for child-directed input, focus stimulation, using communication temptations, and of course, using daily routines. All right, so if you are still struggling with signs in therapy, give it time. Remember the importance of modeling. You can try hand over hand. I try to follow the child's cues on that because a lot of kids are resistant to that, but it can be an effective way to show them and have them get that feedback for how to produce a sign. And then consider if the child is missing some of these very foundational skills, we might need to go back and spend some time working on communicative intent, joint attention, social engagement, and other early imitation skills. Let's talk pretty quickly about some therapy tips and strategies for using signs. We'll always want to say and sign, so pairing the word, the spoken word with the sign. Use that down here for the second one, promote the spontaneous use of signs by, once they're imitating a sign, giving them that expectant look and waiting for them to initiate. So trying to fade that modeling once they are able to imitate. And then last, we're going to talk about using verbal routines with signs. So I love the strategy for teaching core and functional words and incorporating signs. So what you do is you create a verbal routine and you practice it so the child learns it, and then you try to see if they can fill in the final word. So examples would be, I need help, or time to eat, let's go out. So you can see how you can use the signs within that verbal routine and see it once you establish those, pausing to let them fill in that target sign. And these are a great way to contextually teach functional and core vocabulary. One more tip, using signs for prompting spoken words. Once you've introduced signs with a child and they have verbal imitation skills, signs can be used for supporting those spontaneous words. So if you started using signs for functional communication, but now you have a child who's starting to talk, you might be able to give them that sign and look, and maybe now they can fill in the spoken word, help. And I have a little bit of information about using least to most prompting when you're thinking about that. I'm gonna move on to selecting signs. You wanna start with signs that are easy to produce, and choose functional words, core words, and high value vocabulary words. These are the first 5 that I like to teach. Eat, more, help, all done in please. And then from there, I like to incorporate additional functional core words, some routines-based vocabulary, and other high-value vocabulary based on the preferences and interests of the child. I'm going to show you some examples of some vocabulary. Functional core vocabulary, routines-based vocabulary, and then you have your other high-value words, your nouns, verbs and adjectives, foods and animals, and all of those vocabulary posters are from this new resource that I have, Early Childhood Sign Language Vocabulary Set. So I have some information about how to access that resource if you're interested in using some of those vocabulary posters with children in therapy and to help support families with carryover. So there's a coupon code, meetup, for $5 off. You can get more information on my website, mommyandmemilestones.com, or follow me on social media for more information about that. And I think that's all.
All right. Thank you so much, Laura, for sharing all that information about signs with us.